Welcome to Med-Surg Mini number 22 on laryngitis. Laryngitis is inflammation of the mucous membranes of the larynx. It typically lasts for about 7 to 10 days in acute infections, or it can become chronic. The main cause is upper respiratory infections, environmental pollutants, GERD, inhaler use, vocal misuse and strain, and extubation. Risk factors include occupations that require a lot of talking, screaming, or singing, and also having lung or throat cancers. Symptoms would include having a hoarse voice, coughing, a postnasal drip, fatigue, malaise, stridor, or high-pitched wheezing. It's diagnosed through a fiber optic laryngoscopy, a laryngeal mirror, and we would also do a X-ray or CT to rule out any tumors or cancer-related causes. Management non-pharmacologically would be to encourage voice rest and help them to identify alternative ways for communication. Humidification, avoiding smoke or secondhand smoke, using vaporizers, and providing them with frequent fluid intake. Pharmacologically, we could use antibiotics if the source of the inflammation is bacterial. As far as nursing interventions go, we would want to make sure that we have emergency airway equipment available in case the swelling obstructs airflow, and we would want to educate and provide alternatives for communication. Complications is that it may be an indication of cancer, so we would have to do follow-up to make sure that that's not the case. It can cause turbulent airflow if somebody has a tracheostomy as well. And our main nursing problems would be impaired communication, risk for infection, risk for aspiration, and pain. Our nursing assessment would include assessment of the throat structure and any swelling in that area, doing a respiratory assessment, and measuring vitals. Our education would focus on education related to medications, teaching them about voice rest and nonverbal communication modes, educate them on smoking cessation, and proper fluid intake and nutrition. And that wraps up our Med-Surg Mini.